All right, welcome everybody and good morning. My name is Chris Johnson with Agent Support Services. I'd like to take a second to say thanks for taking time out of your day to join us. We're excited to bring you some healthcare reform updates as well as ways in which you can excel in healthcare reform. With our new approach and new technology we have, we really feel it's going to be a benefit for you, the independent agent, and excited that you want to learn more about it. So we'll get started this morning. And obviously the topic that we're going to cover this morning is going to be healthcare reform. And we thought we'd start off this morning a little basic with a couple of the most common questions we get. Obviously, what is healthcare reform and what does it really mean to you as an independent agent? So we'll go on forth with what is exactly healthcare reform. It goes by a lot of names. We hear people calling it different things all the time. But obviously the most common and correct name for it is the Patient Protection and Affordability Act. Of course, it was passed by the 111th Congress of the United States. But that's not always how we hear it. Most times we hear it referred to as Obamacare. So I thought I'd throw this in there. A little comic relief. You can see my little slide there. Of course, we've got the government at work. As we all know, it's been a very slow process, a lot of bumps and a lot of glitches along the way. But looks like we're almost there, and of course, fixing to kick off the first open enrollment season. So, with that being said, what does the first open enrollment season or any of the preceding enrollment seasons really mean to you? Okay, as an independent agent, and obviously for the prepared, knowledgeable agent who has the right tools, we like to think of healthcare reform as a major opportunity. Okay. And it's simple mathematics when you look at it as an opportunity in that you're going to have more eligible prospects now than you've ever had, okay? Guaranteed issue, a lot more prospects. So that simply put is going to equal more sales, right? So moving forward, how are you really going to deal with that increase in business? Okay, you're going to have a lot more people coming in. There are going to be a lot more questions. It's going to put a lot more pressure on you as the independent agent, and that's where we feel we come in and can offer you the support, technology, and tools that you need to succeed in healthcare reform. Take advantage of this once-in-a-lifetime opportunity. So with moving forward, we want to share with you some of our technology and tools that we have that are going to help you manage your prospects as well as your clients a lot better. Going to help you streamline your sales and enrollment process. We also want to show you how to properly grow your business, give you the tools it takes to elevate your business to the next level and expand your book, okay? We also have tools that are going to help you in your productivity management, all right? Because you want to see what's working, what's not, what you have out there, what you've got in the pipeline. That's all stuff that's very important to an insurance professional, as you got to be able to track what's working in order to know what to do more of, what's not working in order to maximize every dollar that you spend, right? We also want to go over, of course, our additional programs and benefits that we offer here at David Crotts and Associates Agent Support and the ways that we really help agents just like yourself excel. So we want to go ahead and get started. First thing we're going to talk about this morning is your prospect and client management systems, okay? You may be one of those agents now who keeps excellent files, but you've got 3 or 4 filing cabinets lining your office, and it kind of gets difficult when you need to really put your hands on something, or maybe it's an appointment issue for you. You know, you got all these appointments that you're going to have. How are you going to manage where you're going to need to be at what times and what you need to take care of? So the first thing we want to talk about is our customizable relationship management system. All right, this system is going to allow you to do a number of things, such as track your leads, okay? So where are you in the process with each individual lead? Very important to know that, right? Because you need to know which ones are ready to buy, which ones are getting ready to buy, which ones have questions, so on and so forth. But to do that, you need to be able to properly monitor your conversations and the actions that need to be taken. So in this customized relationship management system we offer here, it's got a very nice calendar feature where you can monitor the actions you've taken on such days and where you can add in notes about the conversations that you did take and the actions that you took to further that prospect along. So like I mentioned, the calendar, you want to make sure that you're on time every time. All right, so we have a calendar feature with built-in reminders. It's going to help you with things like where you need to be on what days, but most importantly, For you MA producers, you'll understand this a little bit more, but what certifications you need to have complete by what date. So you enter that date in there, and when you got to have that certification done, set that reminder. It helps you to ensure that you do not forget to take that certification, because as you know, with healthcare reform, there's going to be a number of certifications that you have to get in order to sell. So you don't want to miss those, be out of the loop all year and have to wait till next year. So that calendar feature with reminders, it's an excellent tool to have. We also want to help you automate your follow-up efforts by getting you to activate your email autoresponder. Okay, this autoresponder is a very nice feature that you can take advantage of should you go that route in order to put prospects on campaigns. So you know this prospect, Sally, she's not quite ready to buy, so you stick her on a campaign over here that you've customized, you've designed, and it shoots her an email periodically to remind her what's going on and to see what help she needs. It looks like you're really staying in touch with Sally when, in fact, you're out prospecting and seeing other clients. But as far as she's concerned, you're really paying attention to her business, and that'll mean a lot when it does come time to purchase. So these are just a few features, of course, of the new software that we have to help you further along your business and healthcare reform. But when you get all these prospects ready to buy, it's important to streamline that sales and enrollment process as well. So the quoting software, or Exchange. All right, so let's pause for a minute and talk about Exchange. You've heard a lot about that with healthcare reform. In essence, what we've got here is an opportunity for you to have your own private exchange marketplace, a place where you can send your clients. And one of the neat features about this quoting feature is that it does Medicare supplements, life, as well as the under 65 market. So you need to utilize it as you're moving forward in your business. Another neat feature is it allows you to compare plans side by side. Okay, so whether it's a Blue Cross or it's a Cigna, an Aetna, an Assurant, Golden Rule, you'll be able to compare all those plans side by side and let your clients or prospects see what they'll be getting for what price. Okay, but let's say they don't have time to come into the office, right? We're a busy society who needs everything and needs it now. So what about being able to run that quote, email that prospect, let them view it on their own time. So you get to email them a nice, colorful brochure, a side-by-side comparison quote that they can look at on their own time. Okay, it's a nice-looking proposal with an apply button. And what I mean by that is they have the opportunity for the carriers that allow you to do so to enroll right off of that proposal. So they pick the plan they want, they enroll, you get confirmation, it gets sent on up to the carrier. It's a very streamless process. However, what about those clients who have provider questions or coverage questions? Okay, when you're carrying a lot of companies, it can get difficult to know which providers go where or which coverage is offered by which plan. And that's a very neat feature that you'll have on your own website where you can send clients or go yourself. You'll see a little graphic down here where you can select the state that you're in, the product in which you're wanting to research. It'll give you a list of your carriers that you do business with, and you can click on that, and you can see what providers they have, as well as research any coverage questions that may come up. In addition to that, as you always know, we're always here for you to help with those questions. Just give one of your customer service reps here a call, and we'll take care of it for you. One of the other neat features, obviously, with the quoting system is, I mentioned it a while ago, and we'll get further into it in just a second, but when you get your own quoting system, it's going to have a nice consumer direct quoting feature, okay, which means ultimately your website will have these customer-friendly quoting systems where you can send the prospect directly to your website. They can get on there, enter in their information. You get confirmation that someone's on your site and that they are viewing plans on health or life or Medicare. Tells you what plans they viewed. You can follow up on it. But also, they can enroll right there on the spot. So it's a way for your business to work for you when you're not necessarily working. So it's a 24/7 basically face of your business. So we talked a little bit about the tools, and we'll talk about business growth. Now, obviously, the first thing for business growth is to get your name out there, get your company out there, let people know you're doing business. All right? So with this technology package, you're going to get your own personalized website, again, with a quoting marketplace, Okay, so it's privately labeled to your company, got your name, your contact information. All right, and they're going to be your clients or prospects are going to be able to go on there and do research, quote, and see what plans they like, what they don't like, and they're going to be able to enroll right off of that website. All right. So, but in addition to business growth, you got to keep the pipeline full. Okay, you got to keep the prospects coming in. Once you complete that sale, you need another one to come in right behind you. Right, keeping the pipeline full, and that's why we've partnered with excellent lead carriers and programs to be able to pass that along to you in order for you to keep that business coming in, keep that commission on the rise. So in addition, we also offer the industry-leading training, whether it's sales training, product training, whatever you need, we're here to help you because a knowledgeable agent is a successful agent. I mean, the worst thing about being in the field and getting a question is not having an answer. Okay, so we want to make sure that you feel very confident with all the products that you offer in order that you can relay that information along to your clients. So we also feel that marketing is a big thing. Marketing yourself as an insurance professional, marketing your business is somewhere that people can come get those answers, okay? They can feel comfortable coming in knowing that they're going to get top-notch service. So in marketing your business, we've went out and we've partnered with some national marketing companies that are going to allow you discounts on online as well as printed marketing campaigns. So it really is the total package, folks. You get the technology, you get the home office support from agent support services, as well as the partnerships that we've helped form for you. But with all this new stuff, how do you know it's working, right? You want to make sure the money you're putting in, the time you're investing, everything is working. So that's why we've come along with the productivity tracker that's going to allow you to see things like how many times my website's been viewed today. What about those 3 proposals I sent out? Have they been viewed? Okay. What about the leads that I might have purchased or had gave? How have I done on those? Have those turned into sales? Okay, what about the applications button on my page? Has anybody downloaded an app? Maybe they've requested an application in the mail. Has anybody requested an application in the mail that I may have missed that email alert about? Okay, how many people are online? And how much money have I made today? If you see down there at the bottom, there's an example of, let's say your commissions are, and this is just an example, are potentially 8%. So when you sell a policy, it's going to go into here and it's going to let you also track your commissions. So really going to give you a snapshot real quick at the click of a mouse and where you stand in your business, what's working and what's not. But that's not all, of course. You know, when you partner with agent support services, we really measure our success based on yours. So we offer some additional benefits, of course, and one of those are the most important, and that's top commissions. You're out there in the field. You're working hard. You're going every day as hard as you can go. We want to make sure that you are also getting paid what you should get paid, and that is top commissions that are paid directly from the carrier. No third party involved here, folks. I know a lot of MGAs or FMOs out there, they're cutting the checks, the commission checks. You have to wait on them to get it. Then you have to give them X number of days to get it out to you. We don't believe in that around here. We believe your money needs to come directly from the carrier. Okay, we believe that's very important, and that's the way we have it structured for you. And as I mentioned a while ago, we're always here to help you. Okay, so you have dedicated service professionals to assist you with everything. And that includes managing your daily service work, okay, because obviously if you're sitting behind a desk, then you're not out there selling, okay? You know that, I know that. This is how sales goes. But you also have to take care of your existing book of business, right? Well, when you get that problem or you get that question that you don't want to spend 3 hours on the phone trying to find an answer to, call us with that problem, okay? Let your service professionals handle that for you. We'll stay on the phone with the carriers. We'll track down what the problem is. We'll help get it resolved, and we'll call you when it's done and we have the answers so that you can notify your clients promptly. Now, even though you're going to have the ability to quote most all cases on your personalized marketplace exchange website, okay, there are going to be those specialty quoting cases where it just doesn't quite fit the traditional, okay? Again, we don't want you spending hours trying to research which is going to be best. Call us with that case. Let us quote it out for you. Let us do the research. Let's do the homework. Let's keep you out in the field, growing your business, making more commissions, and we'll call you when we have that solution for you. Generally, it's within the same day, no more than 24 hours, and we have that solution for you, okay? And that goes into this overall general support. We're here to help you excel. So those are some of the additional benefits that you get, of course, by partnering with Agent Support Services. So we've talked a lot about the technology, some of the features it has. Obviously, I don't have a webinar that is long enough that I can go into every feature. Be more than happy to do a private demo. All you have to do is email me afterwards, and we'll set up a private demo, and I can really go into more detail. However, I do want to talk about the pricing. Okay, but again, we understand you work hard for your money, and that's why we feel like affordability matters. We want to make this profitable for you, something that you can afford, and it's going to make you money as well. Okay, so there are two options to take advantage of. All right, of course, there's the preferred option and the non-preferred. All right, I figured that was a good thing that we all understood. We all understand preferred and non-preferred drugs, preferred, non-preferred providers. So a little insurance lingo there for you. But we'll go over the preferred program first. Okay, preferred program, you have a one-time setup fee of $75. And what you're going to get with that is you're going to get the full support of Agent Support Services. All the things we've talked about. Okay, all the technology, all the support that we can give you, the top commissions, so on and so forth. Okay. One of the other things that you're going to have to do, though, is you're going to have to put some of your contracts with us. We're going to give you those top contracts, but you got to be appointed through us in order to be a preferred partner. Okay, and there is some production requirement. Okay, it's not a heavy production requirement, but we do require you at least submit 5 apps a month on a 6-month rolling average. Okay, so if you're a little off one month, you can make it up the next. As long as you submit the 5 apps a month on a 6-month rolling average, we're going to offer you the complete technology and support package for $50 a month. Okay, we feel like that's real affordable. You get your own quoting system, own exchange, own website, own customer relations management system, just for $50 a month, folks. All right, but we understand there are some people out there who, of course, want to go a different route, completely solo. They don't need any assistance. They don't need any appointments. They don't want no production requirements, and so that's why we did create the non-preferred program. Okay. Now, it does cost a little more because, obviously, we've got to cover our cost on the technology. Now, with that being said, it's still only a $125 setup fee and $100 a month. Now, best of all, regardless of which way you go, there are no contracts involved. Okay, so you get involved in the program in a few months, and you decide you don't like it for whatever reason, you're not into a contract. You may ask how we can do this. We're so confident that you'll enjoy having these tools at your disposal, that you'll want to stay with us. I can promise you that. But in either case, we do not have a contract. So that's a little bit more about the technology and Agent Support Services and what we can do for you. Now, I did want to take a little opportunity to touch on a few updates we have and a few things that we know for sure as far as healthcare reform and how you're going to be able to take that technology and that support and translate that into more business. Now, I've said it once, and I'm going to make sure I say this again. An opportunity like this only knocks once, okay, folks? They're only going to nationalize healthcare one time, and so this is a huge opportunity that we're fortunate to be a member of, all right? So that opportunity is going to start, of course, January 2014, when 30 million Americans must either obtain coverage or pay a penalty, okay? So you've heard the term pay or play. Okay? All right. But in order to take advantage of this opportunity, agents must know what the mandates are and what they truly mean to your clients or your prospects. You got to know what they mean so that you can pass that information along. Okay? Because there are going to be a lot of people on one end that don't have the correct information or any information at all. As you see by the little graphic down there, I want to make sure that you're that missing piece of the puzzle. You help build that bridge. All right? Because clients are going to fall into 3 categories. Okay, with healthcare reform, clients are going to fall into 3 categories. First category are going to be those individuals who are eligible for financial federal assistance, also known as a subsidy. You've heard the word subsidy a lot with healthcare reform. People really don't understand whether they're going to qualify. That's going to be a major thing. They're going to be looking to you to see if they fall into that category. Are they going to get help paying for those monthly premiums? Okay, but as you're doing your research and finding out whether clients are going to be eligible, you're going to fall into this. You're going to fall into have some people fall into the second category, which are those who are not eligible for assistance. Okay, they're going to be responsible for their full premium. All right. And then you look at those who basically will pay the penalty and not enroll. Okay, we all understand there are going to be some folks out there, it doesn't matter. They're not going to participate, of course. They're just going to pay their penalty and move on. All right, so again, 3 categories that at some point everybody will fall into. All right, so we talked about the categories. Now let's talk about the dates. There's some very important dates that you as the agent need to understand and be made aware of. Okay, so beginning October 1, 2013, this year, folks, not that far away, okay, initial open enrollment is going to start. It's going to run October 1st, 2013 through March 31st, 2014, okay? Now, for all of those individuals that you enroll October 1 through December 15th of 2013, their effective dates on their new policies are going to be 1/1/2014, okay? Again, their effective dates will be 1/1/2014. All right, but how about those individuals you enrolled December 16th through March 31st? Okay, here's where it gets a little tricky, all right? Applications submitted between the 1st and the 15th will have an effective date the next following month, okay? Again, I want to repeat that, make sure everybody gets it, writes it down. Applications submitted between the 1st and the 15th of each month will have an effective date the following month. However, applications submitted the 16th through the 31st will have an effective date the 1st of the second preceding month. Okay, so on the 1st, 2 months after the application is submitted. Okay, so I'm going to leave that slide up there for just a second. Let you write that down. And if you have any, if any of you guys want the slides, just feel free to shoot me an email, and I'll be more than happy to email these over. Give me a call, and I'll shoot them over in any case. But moving on. All right, so we talked about exchanges and marketplaces, touched on that. I told you about how you could get your own private marketplace, own private exchange labeled to your company with your contact information. So you may ask, well, how are exchanges going to play a role in healthcare reform? Okay, well, there are going to be 3 different types. So let's talk a little bit about those 3 different types of exchanges. The first 2 I want to go over, of course, are the state and the federal operated exchanges, what they mean and what they do. So with the federal exchange, as you know, the federal government mandated that each state either have an exchange or default back to the federally ran marketplace. All right. So for those states who opted not to build their own customized state-based exchange, they will be opted into the federal system. It will be operated by the federal government. Okay, and there are a number of states doing that, folks. However, there are state-based exchanges. There are states who said, okay, we'll run our own, we'll design our own, we'll take care of it. Okay, so you'll have your state-based exchanges, and you just need to either give me a call and I can let you know what your state's doing, or you can punch it into Google and find out relatively quickly exactly what your state has opted to do. Now, the third and most important exchange, of course, are the privately owned exchanges, which is what you have an opportunity here to have your own marketplace. Okay. A place where you can send your clients to enroll. And what the privately owned exchanges and marketplaces are going to do are going to help you to capture that business, because you know if they go on your private exchange, it's going to be a company that you represent, okay, a company that you have on there because you have that contract with that company to sell that product, okay. If a prospect goes to a state or a federal exchange, they may or may not have purchase a product that you are appointed to sell. So if they go to your exchange, you know that they are going to purchase a product that you're going to get paid on at the end of the day. So we talk a little bit about the exchanges. Let's talk about a little about the products that are going to be coming down the pipeline. And they're going to be 5 plans in which companies can offer, with the first being the Platinum, the 90% plans. Okay, now, are we going to see a lot of 90% plans? Personally, I don't think so. I think that companies, it's hard to reach those minimum requirements to get that 90% copayment, and frankly, I think it's going to be a tad bit too expensive for most individuals to afford. But there are going to have other options. Of course, one of those are the Gold plans. It's an 80% copayment plan, which generally, we see a lot of that in the under 65 market, and a lot of agents has been around a while. We're used to seeing 80-20 plans. But of course, you also have the Silver. Okay, and with Silver, that's the benchmark plan. That's the plan that the federal government's using to calculate subsidies. Okay, that's their benchmark. They project that a lot of Americans will opt for the silver plan, both because of its cost and its coverage that at least it will offer. All right, but you also have the bronze plan, which is going to be the 60% plan. There's one more plan you don't hear that much about, and that is the catastrophic plan for people who are age 30 and under. Now, I think this is an opportunity, personally, for the select few agents who really come to understand this catastrophic plan and know how to present it properly. Because as we all know, the under 30 age group is going to be hit pretty hard on an increase for what they're used to paying, okay, because of things, it being community rated, and smoking rate-ups will be the only thing that insurance companies can classify for. So with this catastrophic under 30 plan, it's a way for you to bring that segment of the population in that's not going to want to pay, maybe just pay that penalty and be done with it, but make them understand that if something bad happens, you can offer them some coverage at a decent price. So it's going to be important to understand that catastrophic plan. That really ends our presentation today. Again, I want to thank you for joining us. If you have any questions or want to learn more about some of the, maybe a private demo for the technology and tools that we have, I encourage you to call me or call one of the other support members here. We'll be happy to take the time to get you a demo set up. If you have any questions or anything, you're also encouraged to email us at info@dcrotts.com. And, of course, you can also visit our website 24/7, because we understand with all the changes coming down, healthcare reform this close to coming in, you have questions, but the good thing is we have the answers. So we're looking forward to assisting you, and we'll talk to you real soon, folks. Thanks again for joining us, and have a great day.